Patient comes from floor and nurse meeting RN gives report to nurse Plummer LPN.
Hello, Ms. Palmer. How are you doing today?
Good, how are you?
Doing good. We just got a new admission from the ED, Mrs. B. She came into the ED last night. She's been having sticky black tarry stools for the last 3 days, accompanied with lightheadedness and fatigue. She does have a history of an ulcer, but nothing that's been in the present to bring any concern up to her. She does take NSAIDs for back pain and has also added 1 aspirin a day for prophylaxis for cardiac reasons. Her heart rate was 110, blood pressure was 120/80, and it does decrease to 90/60 when standing, so she's got that orthostatic hypertension. So be careful getting her out of bed. Maybe just do a bedpan for now. Respiratory rate is 20, oxygen 95%, and temperature is 36.8. She's being admitted they're trying to rule out possible for GI bleed.
Okay.
And then you're gonna have a student nurse following you.
What you reading there?
Just a little bit of this and a little bit of that.
Oh, yeah.
Just looking at these necklaces with my husband can't afford it because he's broke.
Oh, no.
What you talking about me like that for?
Ain't nothing but a cheetah.
Yeah, okay, honey.
Okay. All right, your blood pressure is good. It's 120/80.
Okay. So I'm not dying.
Nope.
Awesome.
Hanging in there. And your oxygen. Ma'am, I think your husband's getting a little frisky over here.
Just keep on. You don't want to get nobody else chlamydia, honey. Yeah,
I
just
never
what
gave
you
you
know.
chlamydia.
He gave me chlamydia.
Stop telling everybody that. Oh, no. I'm so sorry to hear that.
I'm sorry too. He's on his way out though. You can tell. Hair falling out everywhere.
Oh, that's sad. How long have you guys been married?
We've been married 20 years. It's not that sad.
Oh. Well, that's great. You just put this under your tongue.
How long you been working here, honey?
No, just a couple years.
Excuse you.
Okay, let me take your pulse.
Or you can take my pulse.
He's very friendly.
He is.
My heart's a fluttering.
Sorry, he's on his way out soon.
Oh.
Woman, would you stop saying that?
Ready to meet your maker. Sick of him.
Okay, it looks like I'm all set here, and I'm just going to report that to your nurse. Can I get you anything else?
No,
You
honey,
give me
I'm fine.
something.
You get
Oh, I think you need to keep him under control there.
Are you waiting for them to kill me? Did you not get what he said? There's a big screw loose inside you. I will rip it out of your head. As a mad dog on the rampage. If you think you'll change, save your breath. Just say yes, I don't care if you love him. Princess Life, is it all over death?
So Deshauna LPN goes into the medication room to prepare medications to be administered. The medications listed are hydrochlorothiazide, aspirin, ibuprofen, amlodipine, and over-the-counter Tums.
Thank you for calling, nurse. I will discontinue the aspirin, over-the-counter Tums, and ibuprofen. I would like to start her on a PPI of Nexium after the EGD with biopsy is completed. Please make certain the lab tech comes to draw a CBC panel, BMP, and a PT. Patient can remain on a lactate ringer IV solution until NPO is lifted. She will need to remain NPO for 8 hours before the diagnostic procedure. I will place an order for all these things. but I'm also concerned by his alcohol use and smoking with the ulcer. Please call his PCP if any additional referrals are needed. Thank you.
Okay, thank you, doctor. I will update the RN to the changes.
Orders are placed by physician, and Deshauna and Abby report their findings to Christine and update on changes in patient's meds and diagnostic prep. Lab technician comes up to draw order.
Good morning. What's your name and date of birth?
The hell your problem is?
Can you just tell, it's casual Friday. Can you tell me your name and date of birth? We gotta get this done.
What's
All
your
right.
problem?
All right, good. Okay, so you got some labs you need to get done. So I'm Colleen, I'll be the lab tech in case you didn't figure that out yet. So I'm gonna need which arm? This one?
No,
Which
actually,
one?
it's this one.
This one? All right. Do you have any allergies to latex?
No, ma'am. No,
Nothing?
no.
All right. Let me just get set up here.
What time you get off, Miss Colleen?
As soon as I'm done with you.
That camera's sitting up in here in this room.
I'm sorry, you said you wanted a 14 gauge is what you just said, or no? What did you say?
I don't like
didn't hear.
needles. So try to give me the
Well,
smallest one
listen,
that you got.
you're not going to like them any more in the next couple minutes than you like them right now. So let's just get this done, right? Right. All right.
Who hired you? Let me know so I can have them fight.
Listen, I don't report to you. I'm just here. You got to get this done. Listen, you like to drink and smoke. That's why you're here, lady. I'm just here to draw this blood, okay? You're going to feel a pinch, right? Oh, that's not a good one. I'm sorry. Ooh, I'm sorry. You're right. All right, that looks good. Hang on now. Let me get that one.
Excuse you.
Hello, Mrs. B. Hello, I'm Christine. I'm the RN that was working with the girls today. Can you just verify your name and date of birth for me? Thank you. And your name? All right. Okay. All right. Go ahead, open up your mouth wide so you can come out. All right, great. So that's good. And you've got some juice here. Are you thirsty? Yes. All right. Little sips, okay? Yes. Good afternoon, Dr. Duggar. As you know, Mrs. B was admitted yesterday for some black starry stools and nausea and dizziness.
Yes, Nurse Meany, I have spoken with Dr. Babb, and he states the H. pylori test was positive. He placed an order for tetracycline 500 milligrams 4 times a day, taken with meals and at bedtime for 14 days. Let the patient know that we need to make sure that she is safe and determine her gag reflex has returned. She can start on ice chips. I also think it would be best for the patient to talk about her alcohol consumption with someone. Please ask social work and dietary to come up and help with supporting the individual, maybe offering a support group and dietitian to notify of a specific low acidic diet.
Knock, knock, knock. Hello, Mrs. B. It's me, Christine again. Hi. All right, yeah, can you just verify your name and date of birth? Thank you. All right, so the doctor said you could have some ice chips for now. That's what we need to start out with. All right. Well, this is your mimosa. We need to take this out of the room. And I also spoke with your primary care provider, and they want somebody to come in and talk with you about your lifestyle modifications.
Okay.
All righty.
You guys just taking everything from me.
I know, but you know, with the alcohol and the smoking, the stress can worsen the gastrointestinal symptom that you've been having. It can increase.
Meany, RN, calls for social work and dietary to meet with the client. Nurse Meany speaks to the client regarding proper, whatever this is, coming up to speak with him regarding getting him some assistance with management of his health. Cue dietitian Bree.
Doctor. Hi. My name is Brianna.
How are you?
And I would like to discuss with you some dietary changes that your primary care provider would like you to be aware of. So, considering what you got going on, we want you to try to stay away from like acidity foods. We want you to try to stay low sodium and high protein to kind of help with that bleeding and get you to healing and feeling better.
Oh, so does that mean I can't eat my pickle sausages?
We
I
would
love
like you to
pickle
stay
sausages.
away from that, or try to at least cut back on them. I have some information for you here. I don't know if you'd be willing to read through it if you want to kind of go through that together. Or even take some time and let me know if you have any questions. I am looking forward to setting you up with an outpatient nutritionist to see regularly so we can get that kind of.
Wait, so what time? Because I got bingo during the day and I cannot miss bingo.
Okay,
That's
well,
just
I'm
taking off
sure
the
we
bingo
can
time.
work around bingo. To health, is our priority here, and we'll get you to bingo.
All right, so what can I eat?
All right, well, let's go through this. So 50% of the world's population, it causes stomach inflammation, so that's not what we want. So we want foods, kind of blander foods for you.
Ooh,
Yeah.
bland.
Yeah, so we don't make that GI tract rough, like roughage, such as, raw vegetables. We want to kind of steer away from that.
Ooh.
If you have vegetables,
Gonna be
make sure you
hard.
cook them.
All right.
Okay. Just kind of go through this. A high-fat diet has been shown to increase stomach inflammation, so try to stay away from high fat as well as that high salt, as I mentioned prior. Low sodium will be good to go.
So does that mean no fried chicken?
I would steer clear from the fried chicken. I know that might be a little hard,
Yes, very,
but
very hard.
at least cut back.
Alrighty.
All right, so I will give you some time to read over that. Okay, let's try to read this. Yeah. And then I will give you some time to read through that, and then let me know if you have any questions, okay?
Mm-hmm.
All right.
Time to get it. Do the CJ Coma desk, do the CJ Coma desk, do the CJ Coma desk.